Now, countries around the world are working to flatten the curve of the coronavirus pandemic, and flattening the curve involves reducing the number of new COVID-19 cases from one day to the next. Let's find out how states are responding in Nigeria. And Dr. Hassan Sule of the Department of Public Health and head of the Clinic, National Open University of Nigeria, joins us on the program. We'd like to welcome you, Dr. Sule. Thank you for joining us on the program.
Thank you very much.
All right, Dr. Sule.
Thanks for having me.
When a country has fewer new COVID-19 cases emerging today than it did on a previous day, can we conclude that the country is flattening the curve?
Well, yeah, it's more complicated than that because you would have to go longer than 1 or 2 days with less infections before we conclude that the curve is flattening. What we're talking about is the infection rate. That's the number of people an infected person potentially infects. So, which is also called the R rate. If that number goes below 1 over a period of time, then we're sure that the infection rates are coming down and we're on a positive trajectory.
So give us
so
your
as
view.
is the case with Nigeria, we've seen cases go up, number of new cases rise and fall, and then rise again. So we're in a pattern, we're in a swinging pattern, and we cannot exactly say that we're flattening the curve.
Indeed. So perhaps since we're seeing the rise and fall, how do we assess the efforts of the NCDC, the PTF on COVID-19, other stakeholders who are trying to make sure that they curb the spread of the virus?
Well, on their part, I've seen their protocols. It's made public and their announcements are public. On their part, I think they're doing all they need to do and they've done well. However, while this is a disease and what the NCDC puts out is scientific information, people also have a role to play. But then again, with COVID-19, we see that economics come into play. It's a disease. We've been on lockdown for getting 3 months right now. People have to go out to work and get sustenance. So in doing that, there is the chance, and I think which is very important, there is the chance that people come in contact with the virus, and so we have sustained community transmission of this virus. So on the one hand, they are doing well enough, but on the other hand, there is the people part to it, which is a tricky thing. I mean, it's a balance we need to get as a society, balance of having sustenance and keeping away from spreading the virus. But on the whole, the NCDC, looking at the indices, they've increased their testing capacity. They've been able to train thousands of manpower to help curtail the infection. And then, of course, the PTF, Presidential Task Force, working in concert with state governments, have been able to impose necessary measures which will help slow down the spread of the virus. So at best, it's a balance, which I think we're gradually getting to a point where we reach balance, but we're not there yet. Yeah.
Okay, perhaps finally, we're having more molecular laboratories from what we used to have to 33 now. Does more molecular labs mean more testing? Do you think we can reach our 2 million target in 3 months or 50,000 tests per state in Nigeria?
Well, there's a lot of those targets depend on a lot of factors, availability of the reagents and the machines you need for those tests to achieve those targets, because we're also in a situation where there is demand for these machines and these reagents from virtually every country on earth. So possibly the federal government, the presidential task force on COVID-19, and the NCDC working together, possibly, I see a possibility of them increasing their capacity, but to reach 2 million tests per day, that remains to be seen.
All right. 2 million in 3 months. Well, thank you so much, Dr. Hassan Sule, the Department of Public Health, Head of Clinic, National Open University in Nigeria. Thanks for joining us on the program.